Hello, and welcome back to the Aced It podcast. This is season 9, of course, where we turn science into sense. In this season, we provide 10 timely episodes with the hopes of helping listeners understand what we can learn from current research on harm reduction. And let me just say, there is so much here to learn. So, I'm glad you're with us. I'm Danielle Rudes, your host, and this is Aced It. This season, we'll take a look at harm reduction. We will explore what barriers people who use drugs face when seeking help, including the stigma that comes along with substance use. In later episodes, we will also explore how existing harm reduction programs are viewed by those who use them and those who help with providing these much-needed services. Our last couple of episodes of the season will explore the research that looks at existing harm reduction programs to learn what works and what doesn't. But first, let's talk about the basics of harm reduction. Data from the Substance Abuse and Mental Health Services Administration, or SAMHSA for short, tells us that in 2022 alone, there were roughly 100,000 overdose deaths in the United States. The Drug Abuse Warning Network, DAWN, also estimates that in this same year, over 500,000 individuals visited emergency departments for non-fatal overdoses. These numbers are high and should be concerning. This is especially so because many people who have active substance use disorders do not receive treatment. In fact, SAMHSA reports that only 10% do receive treatment. So harm reduction efforts are very clearly needed. The goal of these efforts is to provide people the ability to lead full lives that are not hindered by physical or mental health problems linked to substance use. Some examples of harm reduction services include providing people with naloxone, an overdose reversing medication, and linking substance-using individuals to education services and counseling. But these efforts are often impacted by issues like negative stigma that surrounds substance use. And one way stigma can be spread is through the media. In fact, a 2023 study titled Effects of Media Representation of Drug-Related Deaths on Public Stigma and Support for Harm Reduction, and written by Sumnall, Atkinson, Montgomery, Maynard, and Nichols, shows us just that. In this study, 1,248 individuals living in the United Kingdom filled out an anonymous online survey. They were given mock news articles to read through, and then were asked to answer a series of questions. The news articles covered made-up overdose-related deaths, and each anonymous participant got a slightly different version of the article. Sometimes the story was about a woman, sometimes about a man. Sometimes it covered the overdose death of a younger person, and sometimes of an older one. And sometimes the overdose death was related to opioids like heroin, and in other stories, the drug was ecstasy. Once the participants read through these articles, they were asked about things like whether the person was to blame, whether they felt anger or pity toward them, and importantly for our purposes here, they also asked them about harm reduction support for programs like naloxone, safe injection sites, and opioid agonist therapy. The authors found that study participants felt more negatively when the news article covered an overdose death by a male, the death by an older individual, or one whose drug of choice was heroin. On the other side, study participants were more likely to be supportive of harm reduction efforts when they read articles about individuals who were older and whose drug of choice was ecstasy. Stigmas, as we can see, affect how people view those who use drugs generally. And we also see that these stigmas can affect whether people support harm reduction policies. In short, we can assume that getting access to these important harm reduction programs can be especially difficult for groups of people who experience stigma. In a 2020 study entitled Examining Barriers to Harm Reduction and Child Welfare Services for Pregnant Women and Mothers Who Use Substances Using a Stigma-Based Action Framework, Wolfson, Schmidt, Stinson, and Poole give us more detail about how this happens. Specifically, Wolfson and colleagues looked at all the existing studies that were published between 1999 and 2019 to explore the barriers people who are pregnant come across when they seek substance use and child welfare services. In this type of research, the authors use different online scholarly search engines to pull together studies that focus on a particular topic. Then, the authors use the studies they find in their data and put together their findings. Essentially, what we're getting is a fancy summary of what studies have found over the last 20 years as it concerns barriers pregnant people and mothers who use drugs and who are looking for substance use and child welfare services face. This study finds that there are many different such barriers. First, the researchers show us that one powerful barrier is experiencing stigma at the individual level. For example, women in the included studies often had internalized stigma, which stopped them from looking for help for both their drug use and for their children. Even before trying to get help, women talked themselves out of getting help because they were afraid of the reactions they would receive as individuals who are both pregnant or parents and using substances. Some women also had their own experiences with these two systems, which were generally negative, and so this past trauma stops them from seeking help in the future. And because their substance use, in some instances, is illegal, women were also scared of being prosecuted. The second barrier that was highlighted is interpersonal stigma. This is stigma that comes from a person's family, their partner, friends, or even from service providers themselves. When women do not have support from their friends, families, and partners, they often also experience more internalized stigma. So this can become kind of a cycle of stigma. The researchers also found that women interacted with service providers, people who work for the child welfare system, and people who work with the substance use treatment system, experienced stigma from the providers themselves. This then made the women less likely to share important information with the providers and diminish the trust and respect in the client-provider relationship. The third level of stigma that the researchers found was at the institutional level. These are barriers that exist in the healthcare and social services systems. In the child welfare system, there seems to be a lack of training on substance use disorders, which manifests in social workers putting unrealistic expectations on pregnant people and parents who use drugs. For example, women were asked to provide proof that they have completed a substance use treatment program, that they have a job, and that they plan to have or do have a place to live. Something women who have mental health issues struggled with even more. So the child welfare system appears not to be well equipped to deal with women who use drugs. And at the same time, the substance use field appears to struggle in assuring that pregnant people and parents receive an appropriate amount of support. For example, some substance use treatment programs do not accept mothers, and some that do not provide childcare or resources for childcare while the parent is in treatment. Other institutional barriers include limited available information about what services even exist, long wait lists, and expensive services that do not accept insurance. The fourth barrier that was identified in this study is stigma that happens at the population level. Here, the researchers found that women were often afraid of being shamed by the general public, and so they wanted to keep their substance use secret. They also described their experiences with discriminatory laws that made seeking harm-reducing programs more difficult. For example, children are allowed to be placed in foster care for only a certain amount of time before a parent's rights are taken away. Mothers are then faced with the impossible choice: seek treatment or keep their parental rights. As a whole, pregnant people and mothers are faced with many interconnected sources of stigma that create levels and levels of barriers when it comes to seeking to address their substance use. We, of course, want all people who use substances to be able to seek help without stigma and related barriers. So now that we know that stigma and barriers do exist and what they can look like, what can we do to reduce them? Well, Wolfson and colleagues provide us with some guidance here too. For those internalized stigmas, Wolfson and colleagues recommend group-based harm-reducing programs that allow women to share their stories in a welcoming environment surrounded by others who are in similar situations. Being among a group of peers who are going through the same thing can teach women how to build and develop skills that can help them both with their drug use and with pregnancy and parenting. It can also help them shed some of the internalized stigma they have against themselves. At the interpersonal level, Wolfson and colleagues recommend training and education for service providers. And what's especially important here is training child welfare system workers on substance use and vice versa. educating substance use treatment providers on parenting. Essentially, what these two systems should do is improve communication between each other so that they can better support parents with substance use problems. As part of education and training, the authors also highlight that it is important to make sure that care is informed by a person's history of trauma, their gender, and their culture. This can create an important safe space for treatment and reduce the institutional barrier to harm reduction efforts. In short, there are a few areas in which we can address the stigma that is faced by individuals who are seeking harm reduction services. And a recent 2022 study titled Professional Education to Reduce Provider Stigma Toward Harm Reduction and Pharmacotherapy by Sulzer, Prevedel, Barrett, Voss, Manning, and Madden suggests that education is important and it works. This study looked at a new education program that was developed by people who work in the harm reduction sphere and people who have a history of substance use disorders. The program was taken in person and virtually by substance use disorder counselors and healthcare practitioners. To see whether the program works, the researchers surveyed the participants before they completed the program and asked them about their attitudes toward harm reduction policies. Then, the participants were asked a similar set of questions after they completed the educational program. The researchers found that the educational program decreased stigma significantly. One example includes the following statement, quote, "Syringe distribution programs, which provide clean syringes and needles to people who inject drugs, are effective programs for preventing infectious bloodborne diseases like HIV, AIDS, and hepatitis C," unquote. Program participants were asked if they agreed or disagreed with this statement once before the training and once after. The researchers found that all individuals who disagreed with the statement before they took the education program agreed with the statement once they had completed the program. While this is a promising finding, education works, there is certainly more to do to continue to address stigma-related barriers that people who use substances face. They can include additional focus on those internalized forms of stigma that keep people from seeking treatment in the first place, as well as the stigma that society holds broadly toward individuals who use substances. Families, partners, and service providers are critically important to help in making the first step individuals with substance use disorders can take in leading physically and mentally healthy and productive lives. Thank you for listening to the ACEIT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Alyssa Toman from Texas State University and Sam Houston State University doctoral student Caitlin Bauer. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their spectacular production. Tune in again soon for another episode of ACEIT.